Can you tell me about couples therapy?
I work with many couples, and it's quite different from individual therapy. You know, with individual therapy, you're getting the person's perspective on things, but maybe it's not really that accurate. Now, that's an actual philosophical approach, which is we always try to see things from the client's perspective. We want to understand what it's like from the client's perspective. A lot of people don't understand what empathy is. Empathy is not putting yourself in someone else's shoes. If you do that, that means you're putting yourself in their situation, but you're seeing the context, you're reacting to it, and you're thinking about it in your way. Versus what real empathy is, which is trying to imagine what it must be like to be in that other person's shoes. So when I hear a client talking in individual or couples therapy, I don't see it from my perspective. I try to imagine, why are they seeing it that way? What is going on inside of them that makes them feel this or prevents them from doing that, okay? Because once you understand that, you have a better idea of, what their experience is like and how can you help them find a more adaptive way of dealing with things, okay? So with individual therapy, that's all you're getting is their perspective. With couples therapy, now you've got two different perspectives. Or with family counseling that I do as well, you're getting two or more perspectives. And you're trying to help people come to some kind of consensus on what's going on in their reality, their shared reality. But more important than that, when I do couples therapy, I'm helping each person understand themselves better, understand their needs better, and to learn more adaptive ways of communicating or expressing those needs in the best way for their for their partner to hear it and to be motivated or to be compelled to want to meet those needs. I always tell people, it's irrelevant what you say. What's most relevant is what people hear. So you can say the most wonderful thing, but if the other person is taking it as sarcasm, or if they think that you're belittling them or attacking them, then your message is not being heard the way that you meant, and everything's going to go, it's going to just collapse. So I really help people learn to express themselves better, use the right language. And I tell clients that when you do couples therapy, there's a lot of expectations on each partner. We have to assume, and I don't like people assuming, this is the one time they're allowed to assume. We have to assume that each person is willing to put in the work. Because I tell clients, you don't have to be committed to the relationship. That's something I hear other therapists do, or couples therapists, where they say, I won't work with you until you both commit to the relationship. That's not realistic. I say you have to be committed to the process. Because the reality is, you may find out that the two of you just are not compatible. You may have thought you were, but in reality you are not. Or maybe you were before, but something happened that created a rift. It caused some too much resentment, or the person can't overcome it, or it's years of hurt, or whatever else. Sometimes that's reality. And then, when that is reality, we shouldn't be looking at wishful thinking. We shouldn't be looking at fantasy, saying, if only they would do that, if only they would do that. No. We have to say, this is who the person is, this is who I am, and this is what the relationship is. And if we can't adjust it enough, or if I can't change how I'm dealing with the situation, internally or in my behavior, then maybe, as hard as it is, we may have to call it a day. That's reality. Because I don't deal with fantasy. I don't deal with wishful thinking. I deal with the reality. And when I deal with couples especially, this is with everybody, but especially with couples, I really stress a few things. One is realistic expectations. It's not lowered expectations. It's saying, this is reality. This is what I'm dealing with as a person, myself, and with the other person. And I have to be able to deal within those parameters. I shouldn't pretend it's something different. I shouldn't hope that suddenly, magically, they're going to change. And you know what? If I want the other person to change, the best way to get them to change is that I have to show some change in myself, or I have to show a willingness to try to work together and change. And I always tell clients, from this day forward, you have to be able to convince yourself that I'm going to do my best to stop the patterns from the past. Forget the destruction, forget the hurt and everything. It doesn't mean to wipe it all away, no. But I'm going to try to do things differently. And the reality is, if I'm putting all this effort and I'm reacting differently, I'm talking differently, I'm experiencing things differently, and my partner's doing nothing, they're not committed to trying to make that change as well, no matter how much effort I'm putting in, they're not reciprocating, then you really have to step back and say, well, over the next 20, 30, 60 years, Is this what I really want for myself? And again, it's very painful. Nobody should ever pretend that it's not, especially when children are involved. But you really have to ask yourself, what is best for my mental, physical, psychological well-being? And sometimes it's being in the relationship and trying to adjust it. Other times it's saying, you know what, it's just never going to be, a healthy relationship. Shouldn't be perfect. Nobody should aim for perfection. But we need to know what is tolerable. And if you can't even reach tolerable, you're going to have a very distressful and anxiety or distressing and anxiety-filled life.